And you win points if you are fast, right? You got to be right first, and then you be fast after that. And that's when you get the most points. For example, if one got the answer right, but she was faster than you may get a little bit less points. But nothing beats accuracy, okay, to begin with. And what we'll do is we'll go through the questions. And for each question, they'll have some nugget points to discuss. Let's say if today is about ACE. Let's say today it's about recovery model. Then I'll talk a little bit about recovery model to cover what we learned yesterday. The goal is, hey, can you remember what we learned yesterday? Do you remember the content that we went through, right? And now is, can you apply the content on questions format? Okay, so I wish you guys absolutely the best luck. One fun way to know if you're ready or not, if you score in the top, 20 people here, or even the top 20. I know it's I'll say the top 20 because it's not that many questions, right? That means you are the top dog. That means you are very good. Because if you have 107 people or 110 people playing, man, if you score in the top 20, you are it. Okay, you're very, very, very close, if not ready for the board. Okay, how many questions are we doing today? It's about 20 questions, but each question has rationale. And after each rationale, I'm going to give you a mini small lecture. So even though it's less questions, there is a lot of content that we'll be covering today. Okay, so be accurate first and worry about being fast once you know the answer. Okay, remember, you can only answer on your phone. You got to pick the caller for your answer. Now, Kahoot, it does not allow me to put a lot of characters, which means I have to be very, very creative. It takes a good 8 hours to create one game of Kahoot. It is labor intensive, and it goes through several hands before it gets to me. So that means if you see PT, that means short for patients. If the answer is not full, it means that I didn't have enough space to make a full answer. So what does that mean for you? Make your best, pick the best choice out of those 4 choices, right? So I'll put in, we're about to get started now. I'll put in one more time the link where to go to www.kahoot.it. And then the code is 873-8794. And then pick a nickname. Okay? Good luck, everyone. Let's get started. It's going to be a great day. Do you see your name here? That means you are in. All right? Let's do this, guys. Good luck. Select the best answer from your phone. Okay, we got 20 seconds. Ten seconds, pick your best answer. All right, so guys, what did we learn yesterday? What is about structure? What are the 3 things about structure therapy. What did I was hoping you guys would get this one, right? Structure, like the military, hierarchies, boundaries, and maps, right? The question had maps in it. When you think, what is the core structure of family therapy? So, family therapy as a system and a subsystem, right? With boundaries and hierarchies that shapes the interactions and emotional balance, right? The dysfunction occur when the boundaries are blurred or hierarchies, who's in charge, it's unclear. So it creates conflict, role confusion, and power struggles. So from now and ever, and until you take the test, when you hear hierarchies, you remember of the military to help you remember of boundaries, hierarchies, and maps. And most importantly, enactment. So what is that? Basically, think of yourself as sitting down in a chair and somebody comes and complains to you and you say, no, 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 I don't want to hear that. What I would like to do is for you to say exactly what happens to him, and he will say exactly what happens to you, and I'll watch it back. That is enactment, playing out. So they're going to do a display in front of you that is high yield for structural family therapy. So think of tracking, right? The therapist observing real-time interactions, patterns. Think of mapping, visual diagram of the family structure. Think of restructuring when the therapist intervenes directly to modify the interaction. But most importantly, boundaries. Boundaries, it is very high yield for structure. So if you are getting a question that says structured therapy, think about reinforcing parental authority, clarifying roles, and addressing unclear boundaries, power dynamics that answer to structural therapy. So hopefully this was helpful. Oh my God, how can I go next here? I gotta get out of this. 1 second. Here we go. And now I can go next. All right. So good job, Ray. You're fast and accurate. Okay, very good. And so everybody else here on the podium, good job, everyone. So that is the FEMIC structural family therapy. Focus on identifying, modifying functional families structure, hierarchies, boundaries, right? And maps. These are the three things you need to remember and think about enactment, sitting down and watching the family play out. Okay, good job. Ooh, this is going to be a hard one. Maybe not. Okay, so I said this is going to be hard because Yalom, there are several characteristics of group therapy. And that is an easy point in the question that you will absolutely get on your PMHNP board certification. Now, the question is, are you willing to spend an hour, maybe less than that, but really going through Yalom group therapy? I'm telling you, There is no possible way that you not get a question on Yalom. So it's a matter of, are you willing to give up 1 hour learning, or are you going to pick wing it, right? So hopefully you are willing to learn about Yalom, and I absolutely love it. So Yalom basically is why people join group therapies. So altruism, giving a hand, right? Basically, members gain confidence and self-worth by helping one another, or helping another, better saying. Giving support is actually therapeutic for the person that gives. Universality, right, is when members realize they are not alone in their problems. This reduces isolations and shame. It makes sense, doesn't it? How about existential factor? Existential factors, family members explore meaning, responsibility, personal freedom, accepting that life involves choices and limitation. Group coherence, I would say things like sense of belonging, trust. Interpersonal learning, members gain insight how they relate to another, the practice healthier communication patterns. Catharsis, so high yield. Altruism, giving a hand, meaning helping another person. And catharsis is the emotional release that helps process blurred feelings and promote healing. Think of when you confess to someone. Maybe it's scary, but doesn't also lifts you up. You no longer have to have that burden, despite of the outcome, when you are able to confess. So I think that catharsis is just that, able to speak, right? Release that helps process blurred or those feelings that sometimes we have inside of ourselves. So when you see Yalom, think of connection, self-awareness, and shared healing. Never is about medication, confrontations, or directive leaderships, for example. Okay. All right. So most of you guys got this right. So let's move on. All right. So we have a change of a rank. Here we go. Next question. Five seconds. Yeah. A diverse childhood experiences can cause a profound and lasting impact on mental health. So yesterday we went over several adverse childhood experience. So first, let me call attention to a mistake that I made. In the PDF, I said positive childhood experience when I clearly meant a diverse childhood experience. I think you pretty much noticed that. So what is a diverse childhood experience? Think of adverse life experience that can cause a profound and lasting impact on mental health, like what? Trauma, right? Like diabetes, like STDs, alcohol use, right? Trauma, when it happens specifically in a childhood, aggravates or angers the amygdala, right? Which really dysfunction the HPA axis, causing anxiety, depression, emotional reactivities. So a diverse childhood experience has really increased the chronic risk for other conditions like heart disease, diabetes, COPD, depression, right? So what we need to remember is that therapies like CBT, like trauma-focused therapy, if they're children or adolescents, EMDR can help reprocess the trauma and calm the angry amygdala. Now, think of what I said yesterday. Image rehearsal, right? As a type of EMDR, uh, well, as a type of a trauma-focused therapy. Okay. Now, also remember what I said about a diverse childhood experience. Which condition is not there? Schizophrenia is not there. Bipolar is not there. Please, please, please remember those two examples, right? It may come to be very handy someday. Okay? All right, psych the power. Wow. Okay, next question. Wow. Did it end early, the timer? I don't remember. Yes, it did. Okay. I am so sorry. I'm not sure what happened. Okay. So I love, well, no, I don't. I thought of small people would pick, create a management plan to reduce both positive and negative symptoms of, of schizophrenia. That is a beautiful answer, a beautifully wrong answer. Why? Right? Statement looks good. It does not answer a question about recovery model. What the recovery model never is about, it's not about medication. It's not about curing the condition. It is all about goals, dreams, and aspirations. What else the recovery model is about? It is about personal empowerment, autonomy, and hope. And recovery is never a straight shot to the moon. What is it like? Non-linear, full of setback and learning from experience. So we emphasize strengths, abilities, interests, non-linear process. A setback are expected, right? What are the four H's, or not four H's, the four pillars for the recovery model? We said HHP, C, HHPC. health, home, purpose, and community. You guys need to memorize that, right? Um, and providers works as the coach, supporting their decisions for whatever their goal is. Okay, so I was hoping that more people would pick the blue one because it was very enticing. Now, A, setting specific treatment goals tailored to the diagnosis. We don't care about the diagnosis in the recovery model. There is another trap. So when you look at the question, when you saw recovery model, you should immediately said, what is the recovery model? What the recovery model cares? Then it would have prevented you from picking A and C here, right? And providing the patient with a structural daily routine and manage medication. Okay, let's say I have no idea about what the recovery model is. I still probably, maybe would have got this question right. How? Look at the three answers. It's all about saying the same thing in different ways. It's all about managing the symptoms or prescribing medication. Which one is not, right? Collaborating with the recovery plan with the patients, including personal goals. And that is the essence of a recovery model. Okay. So I know the answer was cut short, and I don't know why, but please think of a recovery model. Just like Yalom, you will see questions of recovery models. Think about the HHPC, the four corners or pillars of the recovery model. Okay, very important subject. You're likely to get few questions, not just one. So spend some time learning about the recovery model. Three seconds, two, and go. Okay. Does the recovery model focus on symptoms? No, no, no. Guys, recovery model is not about the diagnosis. It's not about the medication. It's only about one thing. What is important for you, patient? How can I help you achieve that? Right? And think of non-linear, meaning setbacks will occur. And then you help them get up and go again and learn from the setback. Okay? Any question that's about medication, any question that is about symptoms or diagnosis, it is the wrong question. Answer. Okay? Not in the recovery model. We worry about diagnosis and question in different scenarios. Recovery model, it's all about dreams and aspiration. Please, please, please understand that. Again, recovery models. Yeah, you guys are getting very, very sharp, right? If it's about recovery model, I'm not going to tell my patient you stalled in your recovery. We want to start with more intensity. That is not recovery model, folks. Okay. Now, think of a recovery model. It also goes with motivational therapy, right? So if you think about motivation therapy, non-confrontational and collaborative, right? Empathy, autonomy, partnerships, readiness for change. Now, since we are talking about the motivational therapy or interview, think of frames: feedback, responsibility, advice, menu of choices, empathy and efficacy, right? Empowerment and self-directed growth for the patient. Okay, so it's close to, I mean, motivational therapy is a little bit close to recovery model in some sense, right? Relapse are expected. In other words, is non-linear and we learn from setbacks. Okay. So relapse is normal part of the recovery journey. Let's discuss what triggered the relapse and how we can modify your plan move forward, right? Moving forward. So that is it, the essence of recovery model. Okay, next question. Let's see if it's another recovery model so we can get 100% right. Oh, this is a hard question. Okay, let me just see here the answer real quick. Okay, so it's about ACT, right? What's ACT for? Okay, maybe. So it's managing daily tasks and responsibility. Okay. All right. So this was a hard question. I can see the how it's, it can be a little bit complicated. But in summary, if we talked about ACT, assertive community therapy, first thing you need to think about is keeping the patients out in the community. We don't want them back. We want them out being the best version of themselves, right? So ACT, what is it? It's a community-based, multidisciplinary for individuals with severe mental illness, such as schizophrenia, bipolar disorder, right? Primarily goal, what is the goal of ACT? To promote independence and functioning in the community so that they do not come back for inpatient. And in order to do that, we got to set up a team of doctors and nurses 24 hours a day, social workers to support the patient so they can live their best life. Focus on helping patients managing daily living skills, responsibilities, and social integration. The care is comprehensive, continuous, and team oriented. As I mentioned, it's a 24 hours program. We look to strengthen the patient's capabilities, communities engagement, and really medication adherence. Medication adherence. Medication adherence as part of the goal of ACT. Why? To keep patients out of the inpatient unit, okay, in the community. So this one kind of connected loosely with the goal, and there was a hard question, but good job everyone that picked the right one, the best choice. Ooh, another hard one, but it's about Yalom, right? Foggy, you took the first froggy. You took the first place there. All right, good job. So interpersonal learning, catharsis. What is catharsis? The release of emotions, right? And group cohesiveness, right? So Yalom, interpersonal learning, catharsis, group cohesive, focus really on communication, effective relationship, and partnerships in the group. For the exam, when you hear Yalom, really think of frequently. Well, I would say that interpersonal learning, cohesiveness, catharsis, and altruism and universality are the five major ones for Yalom. So I would make note of that, and really, I would know all of them. But if you just care for the most ones or the most high-yield ones, I would say those five are the most high-yield ones. Okay, but please take the moment to think to learn that. Here you go, another one. Okay, we got 20 seconds.
A cafe?
You have a hot mic
Yes,
there,
sir.
Anna. All right. So I trust that you don't think Yalom, it's about confrontation, medication, and existential factors. So I trust that was a fast finger. I trust it's not about individual therapy. I believe you picked the answer by mistake. And also, it is not about confrontation, directive leadership, and medication management. If you if my assumption is incorrect, please let me know later today or now that we can go over Yalom. Okay, please, please, please. So very important. Guys, you spent many years getting your BSN, costs a lot of money. Then you spent another 30,000, 50,000, 70,000 getting your master's or your doctor's degree. And now you accomplish all that. You are so close from becoming a independent practitioner, PMHNP, right? Board certified. So focus for the next 8 weeks, highly focus, because now is going to be the payoff. Everything that you did up to this moment, it leads or ends at that test. That test is the most important test of your life, our lives, right? Because without that certification, you can't pass. So if you are having problems with Yalom, please let me know, and I will be more than happy to go over with you. Okay. Next question. And I cannot be more sincere than that. I really wanted to clarify. If I wasn't clear, please let me know. We'll go over in different ways. I can come up with 20 different examples on the spot about Yalom. Okay. It's all about group therapy, right? What is altruism? What is universality, right? What is existential factors, right? Okay, next question. It says clear boundaries. Which family therapy is that? So the PMHNP decides to intervene, right? And how we do that? Enactment, right? So when we say structural family therapy, we say structure, like the military, to help us remember boundaries. If you remember what I said earlier today, you would have got this question right, because the question had boundaries. It was about boundaries, right? Keeping the relationship well balanced. We do not want rigid boundaries. We want flexible boundaries, right? Think about hierarchies and maps and reframing. And don't forget enactment. So what is enactment? Role play, right? Allows members to act out the conflict so the therapist can sit back and watch. I don't want them to tell me what happened. I want to sit back and watch. So I'm going to put a little enactment, reframing, blurred here in the Google chat so you can see it and kind of like really think about this, okay? So structural family therapy, think of mappings or maps and genogram. Think of hierarchies, right? Who's in charge in a family? So please don't forget that is likely to be on your test, right? Boundaries. Okay, the goal is to restructure the family interaction to restore health, boundaries, and hierarchies. And by doing so, it reduces the power struggles and confusion. So here it is. So if you are confused or you kind of still need some feedback on this subject, we can assist you a little bit more. All right, look at the Google link. Another link, the chat box that I just sent. Okay, Anton, you took the first place. Congrats. All right, we got 7 participants that have reached answer streak 9. Wow, that's awesome. All right. So it's not about being fast, right? We really care about being accurate. But if you're fast and accurate, you get a place in a podium. Okay. Good job, everyone. So, but keep being right rather than fast. Look for keywords, okay? What is the keyword for this question? All right, somebody got the answer already. They already knew. I see on the chat here. All right, got 2 seconds. Pick your best answer and go. All right. How it is not family therapy. I'm sorry. Structural family therapy. It is system, family system therapy instead, right? Family system therapy. And who is the father of family system therapy is Hayud? Murray Bowen. I put in the chat there, right? So when I looked at the question, it was blah, 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 blah. I didn't even care what the question said, but I saw something that got my eyes really open and wide. And it was self differentiation or differentiation of self and becoming what that is. The problem arises when members lose differentiation of selves and become emotionally fused with others, right? We want to correct that by having self differentiation, right? What is that? Is the ability to balance emotional and intellectual functioning, right? Basically, I'm still the father of the family, but I'm still myself. I'm able to disconnect and have my own preference and and things like that. The more differentiated the person is, the less they are ruled by the family anxiety and emotional reactivity. So that is number one forever and on when you think of systemic family therapy. You say one, Murray Bowen. Two, you say self differentiation. And three, you say triangles and triangulations, right? And sure, you can say also um, mapping, right? Which is part of that. So now I'm going to put in a chat here the 2 things that I mentioned. I already put Murray Bowen as part of that for family system therapy. And the 2 things that I mentioned, self-differentiation and triangles, okay? So look at the chat, see if it makes sense. If it doesn't, let me know. Now, the goal, what is the goal? The goal is to promote self-awareness, autonomy, and emotional maturity within the family. Really, that is everyone's goal, isn't it? So um, think of that. But forever known, Murray Bowen, self-differentiation, triangles and triangulations, and mappings, really who's in charge and who's not. So that probably caused some confusion why some people pick structural family therapy instead. Okay, so now let's take a look at the formal answer. Why family system therapy and not structural family therapy, right? What do you guys think? Bowen, sometimes called Bohemia family therapy, You need to know that name, guys. It is so high yield, and you need to know what self-differentiation is. Super high yield, okay? What happened? No music? Take your best answer, guys. I'm not sure what happened to the music. But the game is on. Okay. Oh, wow. So map, tracks, um, modifying the family structure, right? So let's see here. What is next? So I'm not sure what happened to the music, guys. So my apologies. So that is part of the structural family therapy, right? Enactment. So once again, I'm going to put a little bit something here about structural family therapy, hierarchies, maps. Rigid boundaries is the problem. We do not want rigid rigid boundaries, right? We want flexible boundaries, but we want a clear boundaries too, okay? Okay, so let's see if the next um, slide will give us music. I'm not sure what happened. No music. Okay. All right, we got 30 seconds. All right, so what would be the best answer? So we got bring mental health service directly to Emily in the community. So if we bring a mental health service to Emily in the community, what would that be? What kind of therapy would that be? We just covered earlier ACT, right? A community-based service to help those in need. Why? To keep those patients outside of the hospital in the community, right? Primarily who? Schizophrenia and bipolar patient. And really anyone with problems with medication adherence, right?
Dr. Lopez,
Hi.
you covering the screen. It's not now.
Am I?
Yeah, you were.
Oh, sorry. Thank you. I was trying to fix the music that I really couldn't. Sorry. Okay. Coordinate mental health and substance abuse treatment would be the best answer. I'm not entirely sure what's going on with Kahoot here, guys. Kahoot is not, oh my God, I don't know what happened. It's going crazy on me. So let me see if I can get a hold of Kahoot. Autoplay, I'll take autoplay out. Okay. All right. Couldn't fix the music. Kahoot is not as fun without music. Okay. Okay, so what is the difference between the red and the blue, right? Educating the patient about medication and emphasize adherence. Is that the reason why they are not taking the medication? No, they may have another reason. So what they might going to do is develop a plan with the patient, including medication related goals, right? Like, what are your goals for taking this medication? Or is this like an education thing that you don't know that you need your Abilify, right? So we definitely don't want to do a initiating a referral for inpatient facility for medication management. That is exactly what we do not want to do, because it's ACT. Keeping the patients in a community is what is the goal of ACT, and encourage the patient to attend group therapy to reduce social isolation. It's a beautiful thing, but it is not a goal of ACT, right? Oh, not having music is a bummer. Okay, so developing a cohesive, comprehensive treatment plan with the patient, and including goals related to medication management and social engagement, is the most appropriate approach in the context of ACT, right? It aligns with the principle of patient-centered care, collaboration, and adherence to the patient's holistic needs. Next question. All right, someone said, do not worry about the music. It's okay. Thank you for that. It's just not the same vibe. Okay, so it was about recovery model, right? So what do we say about the recovery model? Hey, what is your personal goals and aspiration? What do you want to get out of life or this treatment? If you have a question, I'm not sure if you have a hand is up, but if you do, uh, you can ask a question totally. If not, it's okay. All right, next. So recovery model never about medication, diagnosis, or treatment. It's all about the patient develop developing their full potential, specifically in the community. Close you ACT, keeping the patients in the community, right? Not back in the hospital. Okay, next question. ACT again. Okay, so I was hoping that somebody would pick the red. The red is same thing as saying ACT program is a short-term crisis intervention. So and for that we have inpatient unit, right? Guys, it is not a crisis intervention, not an acute crisis intervention. It's a long-term goal. Why is important? So important to keep patients out of the hospital. It's not about acute management of the condition. Okay, now the blue ACT provides traditional patient therapy sessions for your concerns. Okay, I get that. Possible. I would put an interrogation mark. How about the green? Focus on medication management to ensure your best. Sure, I'll put an interrogation mark it because it is about medication adherence. Got it. ACT is a team-based model offering a comprehensive community approach. That is the full answer. So if we get blue and green and put them together, it kind of 80% gets to be to the orange answer, right? But the orange answer, it is the full answer, right? It is a team uh, build approach to keep patients out in the communities for those with adherence problems, right? Because we don't want them back in a patient unit. Always look for the best answer. Even if it's something sound good, ask yourself, is this the best answer? Does it answer the question? It includes a multidisciplinary team, okay, community-based service, and a holistic approach to care. ACT focus on medication management and ensure that you receive the right medication to stabilize your symptoms. While the medication management is part of ACT, it does not encompass the full scope of the program, as I mentioned, right? But I can see why somebody would pick that answer. Yalom again. Okay. All right. So clearly we were between the blue and the orange choice, right? Because it was interpersonal learning. So I was looking which of the options has interpersonal learning. Okay. And then it was about learning from others and universality, meaning, hey, other people too have the same problems that I have. I thought it was only about, I was alone in this condition. Go ahead, Latoya, please.
Okay, can we look at that question again? Because it also says something about providing support. And can I get the definition for altruism again?
Okay. Who can give the definition for altruism?
Is it doing what is right?
Close, very close.
I can.
Us.
I can.
Helping
Being able
others.
to
Others.
separate from helping others, from
Selfish.
helping someone else.
Giving a hand, right? I say giving a hand earlier. So when you
Yeah.
help others, you are benefiting yourself. You truly are. When you, that becomes the essence of why you do things. You help others, and it brings this calmness, right? It's one way to, when you feel helpful, that is altruism. I always say giving a hand
Can
to
you go
help
back
you
to the
remember.
question though? Because maybe I read it incorrectly. Can we go back to the question?
Unfortunately, it doesn't.
No.
Oh, it does actually. Show. Let me see. Hold on. Okay. It doesn't. It doesn't
Okay,
give
I
the
have
question.
I can read the question if you want.
Please.
Okay. In a therapy group led by the PsychNP, members actively engage in discussing their personal experiences, provide
Okay, hold on a second.
mutual-
Hold, 1 second, please.
Yeah.
Personal experience. When we discuss our personal experiences, right? We're not alone.
Mm-hmm.
And we also, okay, go ahead. What is the next portion of it?
Next is provide mutual support.
That's where I got hung up. Provide
Okay.
mutual support. Okay.
Okay. All right. And then what else? There was something, the third
And
sentence in there.
explore their interpersonal behaviors.
Okay. So it was a hard question, but one thing kind of differentiated from another as the possible best answer. But good job, everyone. So universality, members realize they share similar experiences and struggles, group cohesion, member actively engage and provide mutual support, and the two answers had interpersonal learning. Members explore their interpersonal behaviors and dynamics within the groups, which is a central part of Yalom. Okay, next question. That is the last question. Who's going to take the podium today? There is a keyword in it. And everyone should get this question right because it's keyword. Two of them. Should be at 100%, folks. 100%. Let's go. Nine, 8, 7, 6, 5, 4, 3, 2, 1. Okay. Now, can someone, if you want to, help me understand why strategic, you pick strategic, the hand like directives, paradoxal directives, straightforward directives, it is strategic. Structural, like the military with boundaries, right? boundaries, enactment, hierarchies, and maps. Family system therapy, 3 things: Bowen, triangles and triangulations, and self-differentiation. So if you learn what we mentioned yesterday, 3 things for each of the therapies, and you went over this morning, you would have got all these questions, or most of them, 80% right by memorizing 3 things about each one of the therapies. It's going to take a little time, but if you do it continuously for a week or so, you will master each one of them easily. Sherry, go ahead, ask your question. You have to unmute yourself if you're trying to speak.
That's a mistake.
Okay, thank you, I appreciate it. I mean, the answer or the hand?
The hand was a mistake.
Okay, so you're not one of those that pick structural or strategic, okay? Can you say the 3 things related to strategic family therapy? Okay, I can, but can somebody else say it for me? Anybody that learned?
Strategic, I think of straightforward.
Okay, perfect. Straightforward
Because
plus
in the strat,
Paradoxical.
STRA has straightforward and strategic. And then I think of paradoxical and I think of reframing. That's how it helped me remember.
I just think
All
of
right.
strategic paradox. It could be straightforward or it could be a paradox. That's simple.
Okay, strategic paradox or straightforward. All that is strategic. When we say structure, I think of the military. Has anyone has a different way of remembering structural therapy? 3
I-
things for structure.
I thought of structure as a building, like a structure, and the structure has a boundaries, and the structure has hierarchy like the roof, and then mapping and enactment because you can map a structure. So I kind of like put that together.
Okay, I love that. I
That's
think that's
how I think of it as well, Dr. Lopez, just like she explained.
perfect. I love that. It is the corners, right? It is the ceilings or the floors.
The
Guys,
hierarchies of the family.
the hierarchies. I mean, whatever it helps you, but I really want you to think of 3 things. And if you wait to do this before the test, it's going to be a hot mess that you don't want to be in it. Okay, so the study, the learning happens when you go through it, and the next day you revisit, and the following day you revisit, and then you revisit again to solidify what you learned. This is not easy, okay? Not necessarily easy, but it's very, very doable. You can get it done. All right, congrats, Barbie. Sweet. 1 SS. And the first place is Anton. Good job. Jeanette and probably Dopamine here. Well, everyone, really good job. You guys really did well. You assimilated what we kind of went over yesterday, right? I know it can be a little hiccups. I know it can be a little bit anxiety provoking. You only have 1 minute. But now let's go back from what we learned yesterday a little bit if you have few seconds, okay? Let's just revise it together. It won't take like 5 hours like we did yesterday, but we can do this in 10 minutes. Watch. Let me actually take a picture of the people that I want today, because this is
Also, if you're on the app, you can go over the missed questions again right now. That's what I'm doing.
all right.
Awesome. So
Which
just want to
is
let
awesome.
everybody know to do that if they want to.
Yeah, no, yeah, that is awesome. So let me just.
How do you do?
Whoever has the app, could you please show her
Yeah,
how
so
to
if
do
you
it?
have the app, as it clears, it says either like log in or something else. You click off the screen, like you tap off the screen. Then it will say on the bottom, do you want to go over missed questions? And so you can answer the questions, have literally the same setup, and it'll tell you again, like, yay, you you remembered what that question was, so you get to redo it. That's what I do every time, which I absolutely love, because it just reiterates again the concepts so you recall this information. So
Okay, thank you.
you're welcome.
All right. So I want to just bring this up real quick. So can we revise everything we learned in 5 hours?
Where'd he go?
Sorry, I log off myself by mistake. I was trying to log off Kahoot and I just log off myself from the meeting. So can we revise everything in 10 minutes? Sure, we're not learning, we're just going quick, right? So let's do this in 10 minutes from the beginning, from yesterday. It's going to be fast, okay? So it's not learning time, it's just what you do immediately after you learn, right? So starting from module 4, therapies and related theories. So we talked about Erickson, and we said Erickson, you gotta know the answers. I mean, the age. Age will lead you to the right answer. You are likely to get 3 to 4 questions of Erickson. Is it out of the 17 questions on this module, maybe 3 or 4 is Erickson. So spend the time learning. Okay, so I'm not going to go over each one of them, but here they are. Most importantly, initiative versus guilt, industry versus inferiority, identity versus role confusion, think of intimacy versus isolation, who remembers the stag and the generator, and the integrity, a plate of grits, and the pair from the acronym that we went over yesterday, right? And there you have autonomy, trust versus mistrust, autonomy versus shame, initiative versus guilt, industry versus inferiority, identity versus intimacy versus isolation, generosity versus stagnation, ego, integrity versus despair. If you have your mic on, kindly please mute it. Thank you, ma'am. Thank you, ma'am. Now we talked about sensory motor. Please remember object constancy, object permanency, and remember of bipolar patients that they cannot stay, they don't do well alone, right? And when the therapist goes away, if there is a question on PHG, most likely they are talking about sensory motor. Pre-operational, remember of magical thinking. Remember they're egocentric, right? Concrete versus formal. Remember the C is before the F to help you remember of things like concept of conservation, which also starts with a C, right? Conservation and reversibility, right? And then we talked about the formal, which is super high yield for science project, hypothesis, theoretical and hypothetical hypothesis research, things like that. It is a higher level of learning. And we said, are we going to remember this? And we said the acronym so Peter can fly. S for sensory modem, P for pre-operation, C for concrete, and F for formal. We talked about psychosexual development in Fyodor, and we said no phallic stage, right? And we said, hey, the unconscious mind is proposed that much of our mental life exists outside of our conscious. So therefore, we have no idea. Influences our thoughts, feelings, and behaviors. So affecting who we are today is from the unconscious mind. Okay, only also patriots learn guitars to remember oral, anal, phallic, latency, and the genital stage. And we talked about defense mechanism that there is a little too much to cover now, but kind of go over on your module so you kind of learn them, right? Get your easy points. Motivational therapy. So much of what we learned yesterday was about motivational therapy. If the question is about motivation therapy, it's never confrontational. It's non-confrontational. So what do you do as an astute student that will ace the PMHNP board certification? You will avoid questions that are confrontational. You should not drink. You should go to AAA. That is the best for you. Here is your medications you need to take. That is not good, right? What we do on motivational therapy, we elicit their desire for change. When the patient is ready for change, they will change. And we do that by having empathy or empathy statement and empowerment. In order to get there, we do ORs, open-ended questions, affirmation, reflections, and summarize. And don't forget about frame. Very important in motivational therapy. Even though the trans-theoretical model is a model of its own, it still comes back under motivational therapy, as in pre-contemplation. Patient doesn't know he or she has a problem. Contemplation, he was like, maybe I have a problem. When he picks up the phone and says, I'm calling AAA, that is preparation. When the patient drives there and attends the first meeting, he is on action. And then if it comes to action too many times, up to 6 months, right? When the past 6 months, he was on maintenance phase. Okay? Think of frame, feedback, responsibility, advice, menu, empathetic, and self-efficacy. We just cover the trans-theoretical model of change. When we're in pre-contemplation, don't tell patients what to do because they don't have a problem. They don't see it as a problem. So why would you tell them what to do? And so your goal is to provide feedback and awareness. On the contemplation phase, you're thinking about it. So what you want to do is give them what is the benefit of changing versus the consequence of staying the same. When they are in the preparation, you say things like finding or you provide realistic resources for change. On action, you provide encouragement and specific advice to continue the change. And very important, on the maintenance phase, once they've been over 6 months doing what they said they were going to do, alert them that pitfalls will happen. So you want to find what the pitfalls are to help the patient identify them. For example, if they are a drinker, maybe hanging out at the bars with the same drinking crowd wouldn't be a wise decision. All right, so we talked about Lewis change theory. We talked about the driving force, restraining force, and the equilibrium. The driving force is what pushes towards the goal. Restraining force is what pushes down. And there is an equilibrium in between both of them. And that it can be said as unfreezing. When we say the unfreezing, it helps the patient get off old patterns where it was unproductive. So in order to do that, there is an increase in the driving force and decrease in the restraining force. Then there is the change stage, which is moving to a new level, right? And when we do that, we have a different thoughts, feelings, and behaviors. And refreezing is keeping the change as the standard operating procedure from now and ever. We talked about cognitive therapy. It's only the mind changing the irrational thoughts. doing nothing with the behavior, just the mind. So changing the irrational thoughts, the negative thoughts, and cognitive distortions. When we say behavioral, meaning doing something, not just thinking, now we're doing something. How is an action-based therapy on the notion that all behaviors are learned and can be changed. How are we going to change the behavior? Exposure therapy, relaxations, skill training, role model, role playing, so forth. When we marry cognitive therapy and behavior therapy, we get this beautiful made cognitive and behavior therapy. And we said, hey, no journaling and no cognitive restructuring. These are key words that you need to know. All right. So change the thoughts and belief. It changes your emotions. Therefore, will change your behavior. And that is when the magic really happens. Dialectical behavior therapy, we said Marshall Lineham. The goal is for DBT. The goal of dialectical behavior therapy is decrease crisis, right? And if journaling is high yield for cognitive behavior therapy, diary keeping, or sometimes even called journaling for dialectical behavior therapy, or more precisely, to make the diagnosis of borderline diary keeping, it's high yield. Okay. Existential therapy, useful for those in terminal illness, suicidality, and crisis in life transitions, right? Reflection on life and subjective experience. Humanistic therapy, sometimes called Rogerian therapy or person-centered therapy. In reality, this is the bigger umbrella and everything else come under. But no Carl Rogers, and he said, hey, only humans can self-actualize self-directed growth. That's all you need to know. What else we cover? What's the main topic? Interpersonal therapy is for those that are butting heads, right? They don't see eye to eyes. And no marital discord. When you see couples fighting, don't pick couples therapies, pick interpersonal therapy, right? The goal is to improve relationships and change expectations surrounding the relationship. Maslow hierarchies of needs, we said that humans are motivated by hierarchies. Before we seek our DMP, our master's degree, we gotta have safety, we gotta have food, we gotta have shelter, warmth, right? All that is down in the pyramid. And because we have that accomplished, so we're on the top of the pyramid, right? Really, which is self-actualization, which is what Carl Rogers said in humanistic therapy. Okay, DBT, I'm sorry, I'm movement desensitization and reprocess, EMDR for PTSD, and the goal is to achieve achieve adaptive resolution. It's not to forget about what happened, but to be able to live with that. That is high yield. That is important. We covered 3 phases. There are 8 phases of DBT, but 3 that are most likely to be tested is desensitization, and the patients are like to decompensate. What will you do? It is important for the test. Installation of hope. What is it? And what are the things that you would say to initiate the installation phase? And lastly, we ask the patient to scan their body and let go of the anxiety that used to be associated with the traumatic event. Okay, so here we are. Family system therapy. What are the 3 things? Murray Bowen, triangles, and self-differentiation genogram. Okay, 4. All right, structure, like the building or like the military. Boundaries is what we want, right? We want boundaries, setting boundaries, maps, hierarchies, right? Genograms, and hierarchies. Who's in charge in the family, right? Sometimes we do reframing as well. So that is the 3 things that we learn about structural family therapy. So the 3 things for family system therapy: triangles and triangulations, self-differentiation, and genogram. And please don't forget who is the father of family system therapy. Structural family therapy, what are the 3 things? We said, hey, we have to know how genograms and hierarchies and boundaries at minimum, right? Reframing too sometimes shows up. Strategic, I'm going to tell them what to do, like a straightforward directives or a paradoxical directives and reframing. So if you keep 3 things for each one of them, it makes it very simple to memorize. Solution focus for the problems. Like when you say solutions, we are going to look for something that worked in the past to solve current problems, right? And to do that, we say the 3 things as miracle questions, exception finding questions, and scaling questions. Okay, so these are the 3 things that we said, hey, we have to memorize with solution. We're going to look for a solution that worked in the past. How did you solve that problem in the past? Multi-systemic family therapy is exactly that. It's many therapies in one. Why? We want to keep those kids aged 12 and 17 out of trouble. And we are going to empower the family with tools and resources to win, right? To get over this, otherwise they'll become antisocial personality disorder. And then we went on to learn about Yalom, right? All these beautiful therapeutics factors that we went over. Universality, altruism, right? The hand for altruism, as in giving a hand, installation of hope, impairing information. What else is important here? Imitative behaviors, cohesiveness, existential factors. Catharsis is important. So being able to release those strong feelings about past or present experience, because only then healing can occur. Interpersonal learning, right? And self-understanding. We said, hey, if you memorize this early, A heal soccer, or A heal with 3 eyes soccer, you will most certainly remember all this right here. We will not go over now. We went over the class and it is recorded for you to watch. Okay, but remember, the A for altruism, H for hope, I for imparting information, I for imitative behavior, and I for interpersonal learning. S for socialization, O here is for you, universality, C for cohesiveness, and C for catharsis, saying or letting go of those past experiences that are hurtful. E, existential factors, and R for refocusing, meaning the change of behaviors. And then finally, we talked about document stage of group development. Every group goes through the same thing. It starts with the forming of the group, getting to know who is who. They're all getting excited a little bit, and then comes the storming. That's the trouble. right? You start clicking with the one another. I'll hang with this guy because he's from my town, right? And then after that, they start to unite on the norming stage. Finally, they become performing, where they have expectations and they start to expecting others to be at the same level. And lastly, there is the goodbye, the adjourning. So when you say document, you say forming, storming, norming, performing, adjourning, right? So make sure you say it because it becomes second nature. And here is where I said a diverse childhood experience. This is negative, not positive, okay? And I said, okay, we got obesity, we got a heart condition, COPD, bronchitis, depression, sleep disorder, what else? Fractures, diabetes, obesity, but we don't see schizophrenia, do we? Do we see bipolar? Make a note of that for adverse childhood experience. Okay, these are the adverse childhood experience. Nobody wants a STD, not in childhood and not even in adulthood. All right, we don't want none of that. Diabetes, obesity, all this stuff is bad stuff. Alcohol use, none of this. And then we said the recovery model, right? Recovery model. It is possible to recover from mental health is a patient directed recovery. Emphasis on resilience, right? And is never a straight shot to the mood. It's always a setbacks and then go up again and then learn from it and getting better. What are the 4 pillars of the recovery model? And they focus on patients' abilities, interests, and dreams. Never about the diagnosis, never about the medication, and never about the symptoms in itself. We want to know what makes you unique and how you can achieve the best version of yourself in the recovery model, right? The 4 pillars: HHPC, health, home, purpose, and community. ACT, assertive community therapy. What we say, please stay in the communities, don't come to the inpatient. We'll treat you there. And that is a group of doctors, nurses, social workers, physical therapists, community facilitators working 24 hours, literally 24 hours, to help the patients with medication adherence, with emphasis on functioning instead of committing them back to the restrictive inpatient facility. That is the main goal, right? Keeping the patients in the community. So who are the patients? Specifically, borderline personality, not borderline, sorry, bipolar, schizophrenia, and so forth, right? The treatment is focus on the patient's needs, strengths, and desires and dreams for the future, much like the uh, the model here that we talked about, the recovery model, right? So it does fit a little bit with that. So what else? So that's it. So 6 hours of a class, we broke down in 10 minutes. So guys, this is really, really, really what I ask you to do. Once you learn about something, don't just say, oh, I went over module 1 5 weeks ago. You got to review the stuff. Now, when you review, don't make this a journey like I'm going to spend 5 hours looking into this. It's quick. It's quick. And I would say the best way is Mondays, you always review module 1. On Tuesday, you always review module 2. On Wednesdays, you will review module 3. At minimum. Why those 3? Because there will be 107 questions on modules 1, 2, and 3. If you can master modules 1, 2, and 3, you can pretty much close your eyes. I mean, master meaning know everything about it, and you still probably would pass the board. So why worry so much about therapy? Sure, we still want to learn about the therapies, and we really want to be good because we are going to practice, right? But your focus modules 1, 2, and 3. Never forget that. So don't feel distressed about those 17 questions on module 4. Then your next focus is module 5 for domain 5. Okay, so with that being said, I'll stop recording, and as usual, I'll stay back, answer questions about the course, where things are located, or how we could possibly, you could possibly make the most out of the course for you. So I'll stop recording because this will be uploaded for the YouTube channel. If you have questions about anything in psychiatry, now is your time to shine, okay? So let me stop recording. See you guys later.